Mm. All right, Dr. Moore. So we have, first of all, are we calling them boosters now, or what's the correct terminology with these new updated COVID shots?
Great question, as usual, Richard. We're calling them updated vaccines. So just like influenza gets updated every year, we're updating the COVID vaccine to best match the circulating viruses. So they're basically being called updates by most health partners across Canada.
Okay. So the next update will be available later this month, you're saying, correct?
Yeah, so we anticipate in Ontario receiving roughly 350,000 doses of Moderna. Our priority is to get those to those that are the highest risk. So in our long-term care facilities, our elder care lodges, retirement homes, as well as acute care facilities and their staff. So that's our initial priority. With that front load of vaccines, we then would ask others who are eligible to come forward to get vaccinated. And that's where we'd have more of a population approach. But initially, it's for those that really have the greatest need and benefit from the vaccines.
So is there any idea when the general population can get one if they want?
So at the general population, we anticipate mid-October or later to both have our updated influenza vaccine available as well as our COVID vaccine. We hope that people will consider getting both. I know it's a double jab, but it's done once, it's safe, and it is convenient to get them at the same time to be best protected for the winter season, because we do anticipate a longer influenza season with both influenza A and B circulating, but the vaccine that we have, the updated vaccine, seems to have good coverage for both of those pathogens that cause significant illness.
It does, right? Because I was reading that, this Moderna, it covers a strain that's will be almost outdated in Ontario soon. Am I right in reading that or not?
Well, you're following the strain. It is an XBB, so it's in the Omicron family of strains of COVID-19. The benefit is that when we look at antibody production through this XBB vaccine, it covers you for these newer strains called Eris, EG5.1, and or the BA2.86. It's providing antibody protection against those newer strains. So it's as up to date as we can to best protect Ontarians, Canadians, and it should give longitudinal protection as the virus continues to mutate as well, as long as it stays within that Omicron family.
So is your recommendation as Chief Medical Officer of Health that we get this when it's available to us?
Yes, especially prioritized populations would be those that have any underlying medical illness that are at risk at severe outcomes. If it's been 6 months from your previous vaccine and or 6 months from catching COVID, we do recommend getting that updated COVID vaccine, but also if you're open to it, that influenza vaccine too. That double protection really should give you protection throughout the winter months, because it will be a longer influenza season than normal.
So with that in mind, beyond you being here talking to me today, which I appreciate, what are we doing to promote this?
So we're starting this communication. We're working with our federal partners on communicating the availability of the vaccines as they become approved by Health Canada. We're working with our local public health agencies. I'm briefing the Ontario College of Family Physicians tomorrow, so family physicians could be more aware of the vaccines that are available to Ontarians. And then we'll have population-wide communication strategies through social media, through the normal communication strategies to promote the vaccines, and also promote the layers of protection that continue to work well to protect Ontarians against all respiratory illness.
Okay, so there will be an ad campaign is what you're saying.
Yes, we will have a more broad-based communication strategy for the vaccines, but also how to seek healthcare and also how to protect you and your family against all the viruses. So the layers of protection. So it will be a phased communication strategy with those key messaging, and it should align with our federal partners as well.
Because some say you should be out there, ringing the bell down Yonge Street saying get vaccinated. Some say you should be holding a big news conference today. Do you feel you're doing enough?
Yeah, we will continue. So I've done countless interviews today. We'll continue the messaging as the vaccine becomes more available. We will pulse our communication and make it proportionate to the uptake. If we're not seeing good uptake, you'll hear me ringing bells and being louder. I trust Ontarians have come forward in previous campaigns. They've done well at protecting each other and us
We have seen very
individually
poor
through
uptake in
vaccine.
boosters, though, doctor. Very poor. Have we not?
We've had over 3.5 million on this last booster dose, so that's significant. And around 60% of those that are really key, 65 and up, 12 million Ontarians came forward to get the initial first and second doses of the vaccine, and many now have hybrid immunity, which still is quite protective. Our key message is really for those that are at the highest risk to come forward. Those that traditionally get the influenza vaccine, please consider getting the COVID vaccine at the same time. And for all of us that have any underlying medical illness to stay up to date and protected through vaccination. It absolutely it is so beneficial against the risks of the virus, the risks of the hospitalization, the risks of being in an intensive care unit by just being proactive and choosing to be protected through immunization.
Why are you not recommending masking or mandating masking in hospitals?
So directives that traditionally came from this hospital during from this office during the pandemic were enabled only because it was an emergency situation. Now that we're out of the emergency situation declared by the WHO in March, it is up to individual hospital experts on infection prevention control, potentially in consultation with local public health and this office, to make recommendations on masking in clinical settings. We'll certainly provide guidance on the threat or the risk of when influenza, RSV, and COVID are co-circulating. And if that does occur, we would encourage hospitals to have masking in the most at-risk areas like emergency departments and where there's clinical interaction with patients to best protect the hospitals against outbreak. We will make similar recommendations to our long-term care sector as well, but anticipate that it'll be when the risk goes up, when all three are circulating.
Here's what I don't understand, though. I mean, you can correct me on this. Like on construction sites, the government of Ontario mandates you got to wear a hard hat, you got to wear steel-toed boots because you're in an area where there's an off chance something might fall on you. What's the difference with hospitals? There's obviously a chance for infection. There's sick people. Why not mandate masks there like we mandate hard hats on construction sites?
Well, there is significant variability in how the virus spreads across the province. There could be at least a 2 to 6 week spread of how these viruses affect communities. Traditionally, influenza takes 6 to 8 weeks to travel and move across the province. So I could see having regional decisions or local decisions based on local epidemiology. But I am not enabled to write a directive at present unless it's an emergency situation.
What would it take? What threshold would it take for any sort of even masking recommendation to come from you for the general population at this point?
Also, again, great question, Richard. I think when we start to see the co-circulation of all those three major viruses having an effect on hospitalization, having an effect on individual families and the health system, that's when we'll make only recommendations on masking, especially for those that are the highest risk for severe outcomes from the viruses. But it also goes along with all those key layers of protection that include hand hygiene, staying at home when you're sick, covering your cough in public, improvements in ventilation and filtration of air systems, as well as wearing a well-fitted, well-constructed mask like an N95 in high-risk public spaces. But that's if you're really at risk for severe outcomes.
It leads me into some of my final queries for you, and that is like, how worried are you about this new variant? Do you think it could lead to a worrisome uptick in hospitalizations this winter?
So at present, with the circulating strains, we're quite confident that they're not showing any increase in severity of illness, that they are well protected through active immunization. Our tests continue to work. Our treatments of Paxlovid and in-hospital therapeutics continue to work. So I follow, does the test work? Does the therapy work? And do our immunizations work? And the tick boxes are all yes, yes, and yes. So I think that this current activity will reach a plateau and will settle. And what we're following over the last year is ever decreasing burden of illness, hospitalization rates with each subsequent wave, only because Ontarians have been so good at staying up to date with their immunizations, staying protected, and using the appropriate resources like testing and access to Paxlovid if needed. That has significantly decreased the burden of this illness on our community. And hence my concerns and my worries are diminished as long as I'm seeing the tests work, the treatments work, and the immunization and level of protection for all Ontarians still being at a protective level.
When you say plateau, when do you see it plateauing, and what's your fatality projection for such a plateau?
Well, fortunate, Richard, as we've been seeing, the mortality rate has been very low in Ontario, and the overall need to have patients in the intensive care unit has been very low as well, relative to other waves, given the population immunity that we've maintained. We do anticipate, as long as we don't get a significant boom, as people go indoors and the potential risk for increased spread, of seeing it plateau this month. We've already seen in the UK that the illnesses are plateauing, hospitalizations are plateauing. We're watching our southern partners in the United States that provide data to us as well. And certainly we'll watch the information very closely. These waves normally last around 3 months, and we're well into 8 weeks of this at present. And do anticipate seeing it slow down as we build population immunity, but there will be a next, sadly, and that's why maintaining population immunity through immunization is so important.
Next wave, like December, February, do you have any knowledge of that at this point?
Projecting at present, but the way the virus is behaving as we look backwards is smaller waves of infection every 3 to 4 months. That's been the pattern in Ontario over the last year or so. We're monitoring that very closely. We still have very good surveillance, excellent genomics across Ontario, thanks to PHO and all partners. And people still come forward to get testing. So we're monitoring all of the strains, and all of the data analysis is still being monitored very closely. So it is my hope that this will plateau and decrease, but I can keep in touch with you as we monitor this closely.
I appreciate that. Would you like to see the free rapid test be made available again?
So we have recently sent a letter out to all our primary care partners that the free RAT test will be available to be ordered for their clinics. Pharmacies can continue to order them. Health units can continue to order them to make sure that they're available and accessible across Ontario. I hope our partners continue to order them and have them available. We certainly have ample supply. And even with the change in the virus, if it's a positive, we do think that that is a true positive. It's a negative. We would recommend repeat negative at least 24 hours apart. If your symptoms persist or get more severe, that's a time where you should seek healthcare consultation to see what virus is causing your illness, or if the RAT is just low sensitivity at that point.
Last question. What did you make of Dr. Tam news conference the other day? She was all masked up, as were her colleagues. Did you agree with that?
Well, that's an independent decision. I don't know what risk factors she may have or what exposures any of those individuals may have had, but it's an individual choice. And as a physician, I'm sure she did a risk assessment. I'm not privy to any of her inside medical information, but I can understand from time to time that you want to mask if you're recovering from COVID, if you've been recently exposed to COVID, to protect those around you.
But generally speaking, you don't think I should wear one just going out shopping if I'm healthy?
At this point, I personally haven't been doing it. And if you're a healthy young individual and you're staying up to date with your immunizations, I think that's ample as you're following the layers of protection, the other additional layers of protection. But if the risk rises in Ontario, we'll certainly keep you informed.
So bottom line, you're not too worried about what's going on COVID-wise right now. Is that fair to say?
Bottom line, as long as we maintain our layers of protection, maintain our immunity at a population level, take advantage of this updated XBB vaccine, I think we'll be in a good position COVID-wise. I do think it'll be a difficult influenza season, as usual, a difficult respiratory season, and we all have our role to play. to stay up to date on all vaccinations, to use those layers of protection. But as compared to last year, which was significant, I think, don't hold me to this, Richard, I think we're in a much better position. We've worked with all our health system partners all summer long to better prepare our system to respond to meet any surge in demand, especially with our pediatric hospitals. And I have greater confidence in our health system's ability to respond, given all that work we've done all summer.
Doctor, I appreciate it. Thank you for doing this. And hopefully our Leafs will pleasantly surprise us this year. Hope springs eternal, as they say. Doctor, thank you. I appreciate it.
Thank
Take
you.
care. Bye-bye.